HIV testing, I was also very surprised that people were so comfortable providing blood sample to have HIV testing done. That was one of my major surprise when we start having this new testing, including the DHS. I mean, the main contribution is we are not only providing HIV prevalence at the national level, but since we are able to cross-tabulate the prevalence with background characteristic of the respondent, we have been able to provide prevalence at the regional level among people with education, no education, according to the Wealth Index, according to many different subpopulations. And that was a huge contribution to the knowledge of HIV prevalence in country. I mean, for instance, it was really a surprise when we showed that the prevalence in most countries, prevalence was higher among people who are part of the richest wealth quintile than in the poorest. Also, in many countries, we have seen that population, the HIV prevalence was higher among people who are the most educated. That was a major contribution of the DHS. You know, the first question we have asked about HIV in the DHS was, I think, in the Botswana survey as early as 1989. But of course, at this time, you know, the knowledge of HIV was very limited, and we asked just a couple of questions. And over time, we have developed many indicators were developed by WHO, UNAIDS, and of course in the US by the PEPFAR program. And so the question we have asked in the questionnaire have changed a lot. We are asking a lot of questions on sexual behavior, knowledge, behavior, and attitude on HIV. Asking different questions, I think so, because there are different new areas we have to investigate. Recently, we have included more and more questions on PMTCT, and I'm sure in the next few years there will be other areas, other additional areas or questions to be asked. In terms of testing, we already have repeated HIV testing in several countries. The problem now is to interpret the result, mainly because the epidemic has changed. There is a decline in the incidence, but there is also more and more people who survive because of the medication. So it's very difficult to interpret the change in the prevalence. So I think that in the next few years we will have to switch from estimating the prevalence to estimating the incidence. I think that will be the next step. Data do not show any increase in any country. So there is stabilization of the epidemic, perhaps a decrease. Is very difficult to know because what I said previously, that with the increasing number of people surviving with a new medication, is difficult to judge. But it seems that the epidemic has reached a plateau, and at least, and perhaps is even decreasing.